Assalamu alaikum. Inshallah, we'll start at 10:35. Just 2 minutes more. Beautiful. Assalamu alaikum. Is the voice clear?
Yes, it is clear. عليكم السلام.
عليكم السلام. نعم clear.
Yeah. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everybody. Bismillah, alhamdulillah, wa salatu wa salam ala Rasulullah. As a continuation from the educational path that the KFUPM is holding, on behalf of the medical center, we are continuing the medical education for the society of the university, not focusing only on the students, but for the society itself. In this webinar, we try to make it different, as we are not focusing on one subject. We try to make highlights on different subjects and different specialties, and make it more concentrated and focus on the goals. Today we were going to talk about topics in pediatrics, obstetrics, dental, and general. Each doctor will present a very short presentation, followed by a question. Inshallah, at the end of the 6 sessions, we will have questions, holding the 6 questions with the prizes. We are offering nine gifts. There will be 9 winners. And in the end, we'll have a half an hour of discussion. We'll start the first topic. We're going to talk about the HPV vaccination. This is a new vaccine, have been raised by the Ministry of Health. It has been added to the card, and it will be a mandatory vaccine for all the girls, especially from the age from 11 to 12 years of age. The aim of it is to eradicate cervical cancer and to minimize the attacks of cancer for the girls as a preventive procedure. The HPV vaccine, next please. It's an abbreviation of the human papillomavirus. This infection is a common viral infection. Usually it's transmitted sexually. And the most important thing about this virus that it can lead to complications like cervical cancer in the girls and genital warts in both sexes. There are certain types of the human papillomavirus. Not all of them will cause cervical cancer. Only 2 types, 16 and 18. Any patient is getting this infection can get the cervical cancer in a chance of 70%. Other complication, genital warts. Any patient with genital warts can transmit the virus to his partner. Transmission, as we said, it's sexual usually. Skin-to-skin contact for a patient infected. The patient who's infected with the human papillomavirus have no symptoms, and the body will eradicate the virus within a couple of years without the need of any treatment. what are the causes? As we mentioned, skin-to-skin contact and sexually transmitted disease. And the risk factor are the weakened immunity patients or the patient who have undergoing chemotherapy for cancer and other causes. Symptoms, there are no symptoms. How we diagnose the human papillomavirus, usually by pap smear, it will give us a hint that there's abnormality, and special tests to check on the presence of the virus. The most important complication is the cervical cancer in females. Treatment. We don't need to treat. The body will eradicate the virus by itself if complication did not appear. The prevention. This is the aim of the adding this vaccine to the card to prevent cervical cancer. When to give? We give girls from 11 to 12 years of age. Some will start even from 9 years of age. It will be a mandatory vaccine in the card. The patient does not have the option to choose either to take it or not because it will be one of the mandatory vaccines. Ladies from 21 to 29 years of age, they are recommended to do the pap smear every 3 years in order to detect if there is any abnormalities or infection by the HPV virus, and try to treat and be aware that she is more prone to have the cervical cancer for early detection and treatment. Ladies above 30 years of age, from 30 to 65 years of age, she's recommended to do the pap smear every 5 years and to check for the HPV virus if there is any abnormality in the pap smear itself. So almost all cases of cervical cancer, they're caused by HPV virus. By now we ended this discussion. Our question is the HPV vaccine recommended for boys, to girls, or both sex? Okay, inshallah, in the end of the discussion, we will have half an hour for any questions. Now we will go to the next participant, Dr. Sana Al-Shamari. She's a general practitioner and she will talk about the heat stroke.
Assalamu alaikum. My topic today is about heat stroke, which is one of the serious heat conditions that can happen these days, especially the temperature can reach to 50 degrees. So we have to know what we mean by the heat stroke, which is the most serious heat-related illness. It occurs when the body can no longer control its temperature. So when the body temperature raises rapidly, the sweating mechanism fails, then the body is unable to cool down. So what's the symptom of the heat stroke that we can recognize, and according to that, we can treat and manage this condition? So some of the symptoms, it can be confusion, changing or altered mental status, slurred speech that can be slow and difficulty to understand the speech, can be a loss of consciousness, hot, dry skin, or even diffuse sweating.
Can you reshare the presentation? It's gone.
It's just
Just 1 minute, we will reload it, please. Sorry for this. No, by the arrow, maybe it's better. By the arrow.
So again, for okay.